My name is Melissa, and I am a health educator for Stanislaus County Health Services Agency. I have actually been a health educator for the last 5 years. So right out of high school, I was headstrong on becoming a physician assistant. So when I started my education at UC Merced, I was a biology major. When I was at UC Merced, I was in between continuing with biology or actually transitioning into something else. And so I actually took one course in public health, and that made all the difference. I was enamored by the work of the professor that was teaching the course at the time. She had done amazing work out in India, getting people access to drinkable water. And so just hearing her experience and the great work that she was doing and the passion that she had for public health, it just opened my eyes, and it made me realize that this was a career that I could see myself in. An average day for me starts at 8 a.m. At my desk. I typically respond to emails, and those can range from requests from community partners for a health education presentation, a series of classes that we offer, or following up on a conversation that we've had with a community partner. It can also look like collaborative meetings that we're hoping to schedule. And then from there, it just varies. I could be providing nutrition education at a school or with a parent group, or I could be sitting in a meeting with a community partner with various agencies across the community. So my day to day is very different. I never have a consistent schedule in terms of what to expect every day. It's not always the same. And that's what keeps this career so fun, is that there's always something to work on, and it's always different. The primary duties of my role include, of course, providing health education. So because I am with the CalFresh Healthy Living program, we have curricula that we get to select. And so with that, of course, I receive training on the curricula, and then I go out and implement the curricula. We always try to collect data to see whether or not our programming is efficacious. And so when I go out, provide nutrition education across a variety of settings with a variety of different groups, from parents to students to even community organizations. I also coordinate trainings that we offer to our nonprofit sector or other community groups that are involved in food security or food access to those members of our community that are in need. Another part of my responsibility as a health educator is to implement policy systems and environmental change. So what that looks like is, it takes a lot of coordination with agencies across to establish that. What we really want to see is organizations establish policies that really sustain some of the work that we do and really embed some of that those systems and environmental changes into something that will sustain beyond just our one time coming in and doing those changes. When interacting with community members, there are a variety of different settings that could be either in an outreach event where we're trying to provide quick nutrition education on topics such as cutting out sugary beverages, incorporating more fruits and vegetables. It could also be when I'm providing nutrition education in a classroom setting, but also encouraging people to participate in settings where they can advocate for changes in policy systems and environmental changes. So engaging with them, encouraging them to make the changes, to be the voice. I don't do advocacy work as a health educator, but we try to empower other people in the community to want to make those changes. The most rewarding thing about my job, I would have to say, is knowing that I'm equipping people with the knowledge and the tools that they can utilize to make healthy decisions, healthy behavioral changes. The most memorable experience that I've had in public health was when I was providing a physical activity curriculum to fourth graders at a very rural community in Merced. It is a very small, tight-knit community, and I remember that in the last session, it was the last of about 12 sessions, the students were asking if I'd ever come back because that was how much they enjoyed it. And for them to say goodbye to me with hugs and just being so grateful, it really made me feel like I was making a difference. I would say for students that are thinking about pursuing a career in public health, public health is very different from the medical field. In the medical field, sometimes you get to see the reward of, or the fruit of your work right away, right? When you see a patient cured, or you can see healing. In public health takes a lot more time. So don't get discouraged if you are putting all this effort into work that might not provide or might not yield fruit immediately. Just keep trying, keep working at it. Partnerships take a while to develop, collaborations take a while to develop. And so if you are aspiring to become a public health professional, just keep that in mind, and it really is rewarding work. Something that has really resonated with me working in this field is that we all come from different backgrounds. There are different things that shape who we are. I think being able to pull from that, and with what I know now as a health educator, and being able to talk to communities and say, I know that I came from a very similar background, and so being able to pull from that experience, I think is something that has helped me in my career. So public health is excellent at convening different organizations across the county that have a vested interest in all things that affect people's health. And they can really be that drawing force that pulls everybody together to effectuate change that can be positive for public health. If I could go back, I would tell my 21-year-old self that that internship that you took at public health at Merced County would be a major driving force in your career.